Welcome to the NCIA Review 2026, where we explore 100 key concepts for the manager license exam. This journey will equip you with essential knowledge for success. Directed care services encompass programs and services that provide supervisory and personal care to individuals unable to recognize danger or make basic care decisions. The governing authority holds the ultimate responsibility and authority for the conduct of a healthcare institution, whether appointed, elected, or designated. Health-related services include non-medical services that involve general supervision, protective, preventive, and supervisory care. Health screening services involve acquiring, analyzing, and delivering health-related data to determine the need for medical services. Licensed capacity refers to the total number of individuals a healthcare institution is authorized to serve, especially for stays over 24 hours. Medical services are performed under the direction of a physician, involving care provided by healthcare professionals. A non-proprietary institution operates exclusively for charitable purposes, with no earnings benefiting private shareholders or individuals. A nursing care institution provides nursing and inpatient care without requiring hospital-level services from a physician. Respite care services offer temporary relief to caregivers, providing care for up to 30 days to foster or private home operators. A temporary license is issued by DHS for operating a healthcare institution until a licensing inspection is completed. Supervision involves directly overseeing and inspecting the accomplishment of a function or activity. Substantial compliance means that any violations found do not pose a direct risk to the health or safety of patients or residents. Unscheduled medical services are necessary healthcare services that are unplanned and require immediate attention before the next business day. Anyone providing direct care services must have a fingerprint clearance card to ensure safety and compliance. New hires without a fingerprint clearance card must apply within 20 working days of employment, and this must be documented. Facilities must verify 2 professional references and contact 2 personal references to assess a person's fitness to work. Ownership changes must be submitted in writing to DHS at least 30 days before the new owner takes over. Applications for assisted living licensure must be submitted 60 to 120 days before the anticipated operation date. DHS must be notified if a manager is absent from the facility for more than 30 days to ensure proper oversight. A facility can begin operations on the effective date of a temporary license, ensuring a smooth transition into service. Medical records must be retained for 6 years after a resident leaves, ensuring compliance and continuity of care. Starting July 2025, each deficiency assessed by DHS could incur a $1,000 penalty, emphasizing the importance of compliance. The biennial period extends until 30 days after the manager's birthday in odd-numbered years, marking a key timeline for compliance. An application package includes all necessary forms, documents, and fees required by the board, ensuring a complete submission. A contact hour is defined as the time a manager or administrator is physically present during required training or education. A license in good standing means no disciplinary actions or investigations are pending, ensuring professional integrity. NAB represents the National Association of Long-Term Care Administrator Boards, a key organization in the field. Work experience in a health-related field includes roles in healthcare institutions or related professional fields, crucial for application. If an application package is incomplete, the board will issue a deficiency notice, requiring a response within 90 days. Applicants need at least 2,080 hours of paid work experience in a health-related field within 5 years before applying. A temporary certificate lasts 150 days and is non-renewable, requiring action before expiration to continue managing. Failing the Arizona exam during a temporary certificate period results in automatic revocation, ending management duties. Applicants must provide addresses for all residences lived in over the past 5 years when applying to manage an assisted living facility. A character certification form requires submission by 2 individuals who have known the applicant for at least 3 years. The board administers the Arizona exam at least twice a year, providing multiple opportunities for certification. Upon passing the Arizona exam, the board sends a notice, and the applicant must submit the fee within 6 months to receive certification. A manager's certificate expires 30 days after their birthday in odd-numbered years, marking a critical renewal period. Inactive managers must complete 1 hour of continuing education per month in the current biennial period before requesting inactive status. To resume active status, a manager must complete 12 hours of continuing education in the 6 months prior to the request. After receiving a written request to resume active certificate status, the board will respond within 7 days, granting or denying the request. If a manager's certificate is revoked, they must wait at least 12 months before reapplying for certification. Managers must notify the board within 30 days of their appointment or termination as an assisted living facility manager. No individual can manage more than 2 assisted living facilities simultaneously. Managers overseeing 2 facilities must ensure they are no more than 25 miles apart. A manager can designate individuals on site to be accountable when they are absent, provided these individuals are at least 21 years old. Designated individuals must be at least 21 years old, have 3 years of caregiving experience, or hold a temporary certificate and have a clean record with the board. Managers or their designees must be reachable by phone or electronically within 60 minutes. Certified managers need to complete 24 credit hours of board-approved continuing education every 2 years. No more than 40% of continuing education credits can be obtained through self-study, online, or correspondence courses. Administrators or managers must keep CEU attendance evidence for 3 years, ensuring it's available for board review. The board allows a 7-day extension for CEUs upon receiving a manager's request. Board approval for a continuing education course lasts 1 year unless changes occur in subject, instructor, or hours. The board can audit licensed managers or certificate holders for compliance with education requirements anytime. An owner is responsible for ensuring training programs certify caregivers or managers in assisted living facilities. A resident is someone who lives in an assisted living facility. Direct supervision involves on-site observation and guidance by a supervising health professional. Within 14 days of a resident's admission, the facility manager must notify the referral agency if contracted. Facilities must keep disclosure copies as long as the resident is present. Referral agencies keep them for 1 year. Operating an assisted living facility without a valid license is a Class 2 misdemeanor. Applications to set aside admissions must be filed within 180 days of the board's entry. Licensees must respond in writing to the board within 35 days after receiving a formal complaint notice. Inactive licenses can resume active status after meeting education requirements within 6 months and paying the fee. The board may impose a civil penalty up to $500 for rule violations by facility managers. Convictions involving moral turpitude can lead to disciplinary action by the board. Using a certificate that doesn't belong to you is considered fraud and deceit. By July 4, 2024, applicants must submit fingerprints for criminal history checks for licensure or certification. Assisted living facility manager certificates must be renewed every 2 years. Unprofessional conduct includes dishonesty, fraud, incompetency, or gross negligence in administrative duties. The board refers to the Board of Examiners for Nursing Care Institution, administrators, and assisted living facility managers. The Department of Health Services is responsible for licensing assisted living facilities, ensuring they meet all necessary standards. For offences involving violence or financial fraud before June 29, 2009, a fine between $250 and $1,000 is required. Facilities must clearly display the name of the designated individual responsible for services, ensuring accountability and assistance. Assisted living services include supervisory, personal care, and other essential services provided to residents. Elopement refers to a resident leaving the facility without permission or supervision, posing potential risks. A primary care provider is a medical professional who oversees a resident's healthcare needs. A residency agreement outlines the terms of residency between a resident and the facility. A service plan describes the specific care services a resident requires, tailored to their needs. Termination of residency occurs when a resident stops living in and receiving services from the facility. Personnel must possess the skills and knowledge necessary to provide quality care in assisted living facilities. Managers must ensure staff receive at least 8 hours of memory care training within the first 30 days of hire. Staff must complete the initial 8-hour training within 30 days of hire, rehire, or return to work. After initial training, Staff must complete at least 4 hours of continuing education annually. Facilities must conduct an elopement drill every 6 months, involving all staff and the administrator. If a resident goes missing, the facility must investigate immediately and notify the department within 1 business day. The facility must review its quality management program's effectiveness at least annually. A manager is accountable to the governing authority for the facility's daily operations and services. Managers must provide required documentation to the department within 2 hours unless stated otherwise. Facilities managing personal funds must ensure a resident's account does not exceed $2,000. Facilities must keep records of abuse, neglect, and exploitation for at least 12 months after an investigation starts. In the event of a resident's death within the facility, it is crucial to report it within 1 working day to ensure proper documentation and compliance. If a resident causes self-injury requiring emergency intervention, it must be reported within 2 working days to ensure timely response and care. Admission signifies the start of receiving health services, marking the individual's acceptance as a resident of the healthcare institution. Emergency safety response involves physically managing a resident's behavior to prevent harm, ensuring safety for all involved. A clinical director guides the behavioral health services, providing essential leadership within the residential facility. Immediate action is required if there's any suspicion of abuse, neglect, or exploitation to protect the resident's well-being. Maintaining documentation of contracted services is essential for transparency and accountability within the facility. Orientation is a necessary step for personnel before they provide health services, ensuring they are well prepared. Employees must retain their files for at least 24 months after ending employment, ensuring records are available if needed. APS verification is mandatory for new hires with a history of abuse cases, ensuring safety and compliance. A discharge plan must be documented within 48 hours after completion, ensuring continuity of care for the resident. Thank you for your attention. Please remember that this information is for reference only and not for medical treatment purposes.